welcome to Apollo Hospitals presents Healers of India. The World Health Organization suggests a minimum ratio of one doctor for every 1,000 people. India, however, faces an acute shortage of doctors and operates on a ratio of one doctor for every 1,700 people. And in rural India, the situation is even worse. Reports suggest that almost 70% of the rural population has minimal immediate access to healthcare facilities. However, there are individuals and organizations that are doing their own little bit to contribute to a healthier India. And on this episode, we are saluting the spirit of these healers of India. So let's start off with our first story, and for that, we are traveling to rural Gujarat. In a world where commercialization is plaguing the medical profession, making it unaffordable for the poor, Charutar Arogya Mandal is standing firm in its vision to be a shining example of nobility and service to humanity. The organization is an outcome of a dream cherished by late Dr. H.M. Patel. A world away from the chaos of the city, surrounded by 100 acres of lush greenery, Sri Krishna Hospital in rural Karamsad in Gujarat is an ideal destination for rest and recovery. Over the last 3.5 decades, millions have walked through the doors of this charitable hospital looking for cure for some of the worst diseases of our times. Without exception, everyone received world-class care and paid only what they could afford.
A hospital which treats patients irrespective of whether they can afford the treatment or not is the first step of giving back. Every year we're doing something like about 10 to 12 crores of concessional treatment based on what a patient can afford. If you go into the ICU, you will see a paying patient next to a patient who cannot afford it. So the quality, the kind of healthcare is equal irrespective of whether a patient can pay or cannot pay.
For Nikhil Rathore, a 10-year-old who battled blood cancer from an early age, the hospital is a center of hope. Nikhil was treated at the cancer center of the hospital and is now leading a healthy life.
અહીંના સ્ટાફે મને એટલો સપોર્ટ આવેલો કે આને અડવાથી ખાવાથી પીવાથી બેસવાથી અને કોઈ એવું થતું નહીં. સર એક વસ્તુ મેં જોયું કે આની અંદર એક જાદુ તરીકે થાય ને જે રીતે ભગવાન મળે તમને એવી રીતે મને સ્ટાફની અંદર ડૉક્ટર શ્રી કૃષ્ણ હોસ્પિટલના ડૉક્ટરો કે સ્ટાફ મને ભગવાન મળ્યા હોય ને એવી રીતે સર મારા છોકરાને નવું જીવન લાગ્યું.
Parents of 2-year-old Kunj had lost all hope on discovering that he has a severe heart condition since birth. But the institution's Bhanubhai and Madhuben Patel Cardiac Center offered him a new lease of life. A team of skilled cardiologists and doctors provided personalized care and operated on newborn Kunj with success.
Normal delivery हुई थी और 2-3 महीने के बाद
It was a normal delivery of my son, but in the next 2 to 3 months, his health deteriorated. He was operated upon at Sri Krishna Hospital for his heart disease. The operation was successful and his health is completely fine now.
सक्सेसफुल रहा ऑपरेशन और हमारा बच्चा एकदम कंप्लीटली ठीक हो गया.
In order to take affordable healthcare to more and more households, Charutar Arogya Mandal embarked on its outreach journey in villages. The Sri Krishna Hospital, established in village Sevale in rural Gujarat, is an example of its efforts. This hospital is equipped with all the modern facilities and ensures that quality healthcare is within the reach of villagers in the region.
We have 6 extension centers, and one of these is a 30-bed, is a secondary care center with 30 beds. It has an operation theatre, it has a lab, it has imaging, radio, it has X-ray, and a trauma center. So it's a self-contained little hospital. It's about 60 kilometers from here. The other centers have a doctor full-time and limited facilities. But what they do is they cater to problems in the local area.
charitable institution also believes that to build a healthy society, sustainable awareness is required amongst the citizens of the region. To achieve this, regular health camps are run at various locations where, along with awareness, people are offered free health checkups, diagnosis and medicines.
Every day there would be a camp in at least 3 villages. So the doctors go out, patients come, there's a health worker. If there's any follow-up to be done, the health worker will do it. In fact, the medicines that are required for a patient, the health worker is given the responsibility by the doctor of ensuring that the packet of medicines that are required by the patient get to the patient through the health worker.
In rural Gujarat, the women are still caught in a web of orthodox societal norms, lack of education and poor health. Charutar Arogya Mandal has appointed dedicated village health workers who gather women in groups and impart knowledge of health problems, symptoms and cures to them. These Good Samaritan health workers make their way door to door, keeping account of the health conditions of residents, offering them medicines, guidance and timely cure. Their consistent dedication has significantly improved rural health conditions and saved precious lives in these villages. I make door-to-door visits in the villages and keep an account of the health conditions of the community. I educate people and spread awareness about oral, breast and other types of cancers, as well as hypertension and diabetes. With dedicated humanitarian work of over 35 years, Charutar Arogya Mandal ensures that no person, rich or poor, has to run from pillar to post for medical care. Its experienced team ensures that people from rural Gujarat receive the care they need with dedication and warmth. Charutar Arogya Mandal is not only changing the face of rural healthcare in the state, but is also making sure that good health is a right for all and not just a luxury for a select few. Charutar Arogya Mandal is not only changing the face of rural healthcare in Gujarat, but is also making sure that good health is a right for all and not a luxury for a select few.